Weight loss injections seem to be the topic of conversation everywhere recently, and when we see anyone in the public eye who's lost a significant amount of weight, everyone's wondering whether they've been using some form of weight loss injection. And we now have a few different medications available on the market. The first one that came out was liraglutide in the form of Saxenda, and this was interesting because it involved daily injections, and the pens came as packs of 5 for one patient only, but yet you found many places selling a single pen. And so there were lots of issues around the safety pathways and the regulations of administering this prescription drug. Yet with Saxenda, with liraglutide, this new class of drugs came to light of GLP-1 receptor agonists. Now the one that's most commonly being talked about is Ozempic. But what we have to remember is that Ozempic is actually a medication for type 2 diabetes. During the clinical studies for its effectiveness for type 2 diabetes, it was also found to have a positive effect on weight loss. But this is licensed under a different name, Wegovy, and the dosing regimes for the 2 different indications are both different. So both Ozempic and Wegovy contain an ingredient called semaglutide, and semaglutide is different to its precursor liraglutide in that it only needs a weekly injection. So that means it's far easier for patient compliance, because if you're going to be taking this at home, you need to remember to do it every day if you're on liraglutide, whereas with semaglutide you can schedule it in for once a week. It's important that you're on the right dosing protocol. It will involve starting low and building up. The most recent addition to the portfolio that we have is something called Manaro, which is called tirzepatide, and this has also now been licensed for weight loss rather than just for type 2 diabetes, and it's the first of this class of drugs that has 2 different actions. It also activates something called GIP. We have now something that may be even more advanced than the one that everyone's talking about. When it comes to administering all of these different prescription medications, it involves a pre-filled pen. You attach a fresh needle to the pen, usually on the abdomen or the inner thigh. You pinch up a little bit of fat, you just stick the needle in there and inject the dose that you've selected. It's important, as I mentioned, to be on the correct dosing regime, because with all of these things you start low and then you can increase your dose as required and as you tolerate it based on your symptoms. What we know is we don't want to go up too quickly because you can have more problems, and that people who are looking to manage their weight may need bigger doses than those who are taking it for diabetes. The side effects are pretty similar for all of these medications, and the most common ones are gastrointestinal side effects. So nausea can be quite common, although vomiting is unusual. Both constipation and diarrhea can be possible. But really the thing you'll notice the most is exactly what it's intending to do, which is appetite suppression. You will feel fuller far quicker. Another side effect I would say that many people have been speaking about is something called Ozempic face. And this is when the face hollows and loses volume due to rapid weight loss. The same can happen if you lose weight rapidly thanks to a gastric band or a gastric bypass, for example. It's to do with this sudden dropping of fatty volume in the face that can leave you looking saggier and definitely hollower. And many people do pursue different treatment options for that. If you're thinking which one might be right for you, we now know from the more recent studies that Manaro can help people to lose about 20% of their overall body mass, which is more significant than the other medications we've had to date. So it's possible that Manaro will be a more effective choice than Wegovy and its predecessor liraglutide. The question about long-term use is an interesting one. What we know is these are medications that are not designed to help slim people to stay slim. They're medications designed to help people who are trying to lose weight and struggling. So what happens when you reach your target weight or complete your course of treatment? What we know on the clinical studies for Wegovy was that 1 in 6 patients had managed to maintain 80% of their weight loss at 1 year. So it does show that if you stop and you haven't made significant lifestyle adjustments, you are likely to regain at least some of the weight. At the moment, we don't know definitively about longer term use. Here we kind of get into the realms of prevention medicine and whether or not we should be looking to treat people before they have big problems with obesity rather than allowing them to become obese before they're treated. And it's something that we don't yet have the safety data on, but I do know that experts are talking about long-term use, and also potentially looking at dosing regimes like, for example, staying on it for a month and then coming off it for a month. But at the moment, guidance about this is difficult to find. Another thing you must be careful of is black market fakes, and unfortunately there has been a real spate of this in the UK recently, where batches of fake obesity injections have been found, and some of these have led to some quite severe health complications. What I would say is this is a prescription medication. It should not be as easy to source as you just ordering it. You should need to go through a consultation process. Although there are online pharmacies offering these medications, it's still all screened behind the scenes. So if you feel that something is a little bit too easy to get and also possibly a little bit cheap, these things are expensive to buy, then you should ask some questions, because what you don't want to do is inject yourself with an unknown substance. Our guidance at the moment is that if someone is over a BMI of 27 and has some form of health problem associated with their weight, then they meet our criteria for using these weight loss injections under the guidance of a doctor. What we would not do is treat someone with a normal BMI who just wants to become thinner or to suppress an appetite. What I'm interested in for the future is to see whether we can intervene with them at an earlier stage of weight problems. So for example, someone is still a normal BMI but is a stone heavier than they were 2 years before, which so many of us have come to accept that year on year we become a little bit heavier, but that's not actually necessarily how it should be. So will it be possible to treat in a more preventative way? Maybe. It's important to note that these are also medications that can have an effect on blood sugar. They can be a really good choice for people who struggle with diabetes as well as having a weight problem. If this content has been useful for you, please give it a thumbs up or send me a little message below, and please do subscribe if you'd like to see more content like this.